Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. Today, we have a very up-to-date topic, this is Zika virus, and we have two distinguished guests with us. One is Dr. Tsoline Kojaoghlanian. She is board-certified in pediatric infectious disease, assistant professor in Children's Hospital at Montefiore. Welcome, Dr. Kojaoghlanian.
Thank you.
And next guest is Dr. Lena Merjanian. She's board-certified in obstetrics and gynecology, and she is assistant professor at Rutgers Johnson Medical School. Dr. Merjanian, welcome.
Thank you.
So we have been hearing a lot about Zika virus. Last year was Ebola virus, but this year is Zika virus. What is Zika virus?
Zika is a virus that was named after the Zika forest in Uganda, where the virus was first discovered in the 40s. And the reason it's in the news lately is because of two reasons. The fact that it spread very fast in the West, affecting travel, and because it seems to have a special liking to brain cells and nerve cells, thus causing all the damage that we've been hearing about in babies and others.
Okay, so now we know that it started from Uganda, like the Merjanian. Where is the Zika virus now?
So currently it is in 36 different countries in the Americas and U.S. territories, and about 46 countries worldwide.
How is it transmitted?
So Zika virus is transmitted in several ways. One, by direct bite of the infected Zika mosquito.
Right.
It can also be transmitted sexually by an infected partner to a female.
Mm-hmm.
It can also be transmitted from a pregnant mother who's infected to her fetus while she's still pregnant,
right,
or even during delivery. There is possible laboratory exposure.
Right.
There are also possibilities of blood
transfusion
exposure, organ transplant exposure, or even breast milk, although there has not been any documented cases of Zika.
What are the signs and symptoms of Zika virus?
The majority of people who get infected with this virus, 4 out of 5 will develop no symptoms. Therefore, they could have the infection and not manifest with anything.
Right.
The small percentage, 20% of cases who do develop symptoms, will develop a low-grade fever,
right,
a rash that's generalized, red spots all over the body, what we call swollen lymph nodes, those are usually behind the ear and in the inguinal area,
right,
as well as what we call arthralgias, which are joint pains.
But usually these are small joints.
Correct, the small joints like the wrist, the hands, and sometimes swelling of the feet, lower feet, especially in pregnant women.
So hands and feet more, the joints in the hands and feet.
Correct.
Okay.
And in addition, conjunctivitis,
right,
which is redness of the white of the eye, is actually a giving away sign of Zika virus.
Obviously, a lot of viruses can give all these symptoms. So what are the differentials then? There are other viruses that can cause
this. Of course.
This
This is a great question, Dr. Karatoprak, because this virus is actually spreading the same way that dengue and chikungunya viruses have spread in South and Central America and the Caribbean. And these viruses are actually hard to differentiate from each other because you can have exactly the same symptoms with dengue, which is fever and a rash, and exactly similar symptoms with chikungunya, which is joint pains and fever. So it is hard for us doctors to differentiate the different viruses that could be causing similar symptoms in travelers.
Why is Zika virus important in pregnancy?
So Zika virus is very important in pregnancy because we know that the virus actually can affect the unborn child. And the other problem is it can affect the baby in any trimester. We think the greatest risk is within the first and second trimester, but we're not 100% sure yet.
Right.
And then the other thing about pregnancy and the importance of Zika virus is that a woman who's currently pregnant can actually get infected through a partner that's infected as well.
Okay, so there's a danger partner giving the symptom to the pregnant lady.
Correct.
Not necessarily the pregnant ladies. How are we going to prevent from this virus?
As we mentioned already, the majority, more than 90% of this virus is going to be acquired by the bite of an infected mosquito. So what we need to do...
So when you said mosquito, I'm going to just ask, what kind of mosquitoes are these? These are homebound mosquitoes, outside mosquitoes, what are they?
Good question. So we have several species of mosquitoes in the world, and only two of them so far, Aedes aegypti and Aedes albopticus, these are their fancy names, are the ones who have been proven to carry and infect people
But
with
they are
the Zika
domestic
virus.
viruses. They are domestic viruses, what I
Mosquitoes,
understand.
you mean?
Yes.
Mosquitoes,
They are
you
domestic
mean?
viruses. It means they love to be in the house.
So these mosquitoes in the United States, the Aedes aegypti, the one who's the very good transmitter of the
Zika virus.
is actually found in the southern states of the United States, such as Florida, Texas, the hot and humid states of our country. Its cousin that I mentioned, the Aedes albopticus, which does not transmit the virus efficiently at all, is actually found throughout the United States except in the northern part. So here in New York and New Jersey, we do have the Aedes albopticus mosquito.
So how about the prevention in pregnant ladies? Or pregnancy, the people that are planning to be pregnant?
So as we mentioned, there is no treatment for Zika virus. So the most important thing is to actually prevent exposure to Zika virus. So we tell our women who would desire pregnancy or are currently pregnant to avoid traveling to Zika countries where there's active transmission.
Right.
They should always stay up to date and look at what countries the virus is actually circulating in at a given time. If they do go to a country with active Zika transmission, it is very important that they don't, one, get bitten by mosquitoes. They should stay indoors. They should stay within air conditioning. They should wear long sleeve shirts,
And the
pants.
repellents, mosquito repellents.
They should wear the EPA registered insect repellents to prevent the transmission. And in addition, of course, as we mentioned, if the male partner is going to a Zika active transmission country, they should avoid getting bitten by mosquitoes. And when they come back, they should abstain with their partner or use condoms to prevent the transmission.
So is there any vaccine being developed right now?
As you know, because there is so much fear about the effect on babies, people are working very hard to find out first how the babies are getting infected and thus create a vaccine that will protect all women of childbearing age against this virus. There are trials starting very soon in both the US and Canada, but it will be at least 6 to 9 months before an actual vaccine is in the market.
So Dr. Merjanian, it's important now if somebody has contracted already Zika virus and they are pregnant, what should we do? What should they do? What advice you will give to them?
So the first thing is they should speak with their OBGYN and let them know that there possibly could have been an exposure. It's important for the doctor to figure out whether or not the patient has symptoms. We do offer blood serum testing along with urine testing depending on when the symptoms are.
Okay.
In addition to that, depending on what the Zika virus testing comes back, we also recommend that women get ultrasounds every about 3 to 4 weeks to see whether or not we see any of the changes that we know are associated on the baby. Like Tsoline had mentioned earlier, the Zika virus actually has a predilection for the nervous system. So what happens is the nervous system gets attacked, the brain actually can shrink, the skull collapses, which is why the baby's heads are small, and the microcephaly. There can actually be calcifications in the brain tissue. There's also eye abnormalities that can occur as well. So it's such a devastating infection.
Really symptoms that is coming or damage coming to the baby.
And actually one of my favorite quotes that the CDC director said, there's never been the bite of a mosquito that has caused such devastating malformations in the fetus.
Dr. Kojaoghlanian, now that we were talking about pregnant ladies, let's assume that a man was traveling and then got the Zika virus and is positive. What kind of precaution he should take before planning a pregnancy with his wife?
Some data is showing that this Zika virus can persist in semen for several months, up to 6 months. Therefore, a couple who is planning a pregnancy and the male partner potentially had symptoms which were suggestive of Zika or was tested and was confirmed positive for Zika should delay their pregnancy for up to 6 months after that infection.
So for men, if it is really infected, 6 months waiting period is must. I think we should repeat again, Dr. Merjanian. How about for women? If they're positive It's not 6 months, it's 8 weeks, yes?
Yes, so if women are exposed to Zika around the time of conception, about 6 weeks prior to their last menstrual period,
Right.
or if they actually displayed signs of the
Symptoms?
Zika infection, they should delay pregnancy for at least 8 weeks.
Okay.
So for the male partner, it's at least 6 months.
6 months
for the female, it's at least 8 weeks.
So Dr. Kojaoghlanian, review for us about the diagnostic testings.
Incubation period of this virus, which means that from the time you get infected to the time you develop symptoms, is up to 2 weeks. So therefore, if someone has returned from a Zika endemic country, within 2 to 3 weeks of that return, if they develop symptoms, we send their blood to the local Department of Health for testing, and we can also send their urine, which because the virus stays in urine a little bit longer, so if 2 weeks has passed and you still have suspicion, you can send the urine actually to be tested.
But it can be in the beginning urine too. Urine is a proof in the beginning.
Of course.
So what kind of discussion goes on in the office with parents?
That's a very difficult situation to talk about because of the fact that we don't have enough information about Zika virus.
Right.
We know that it's we know it's associated with microcephaly.
Right.
We don't know the exact percentage of babies that will actually get affected. And so it's a challenge.
Do amniocentesis and then find out that yes, that baby or fetus is affected?
Right. So amniocentesis currently has been removed from the CDC as part of the algorithm of the workup. However, each individual patient can be evaluated on a case-to-case basis.
If child is born with microcephaly, Dr. Kojaoghlanian, that's for you. Now you have a challenging baby
it's
in your hands.
estimated that $10 million is the cost of taking care of a child with microcephaly. Microcephaly, for those of you who do not understand the terminology, means small brain. As you can imagine, someone whose brain has not developed will have minimum or if any intellectual capabilities. In addition, there is hearing and visual impairment associated with this virus. Therefore, at best, the child will have major developmental delays, and at worst, the child will pass away.
So how many total cases now pregnancy that we have diagnosed in the United States already?
So there's about 400 pregnancies diagnosed in this country currently,
Yes.
and these have all been patients who had traveled to countries that have active Zika transmission.
400 pregnancy. How about total in general, that people they had Zika virus?
Total here in the US that we are aware of, that we have tested and confirmed to be Zika infected, is 1,400. And 14 of them, which is 1%, were sexually transmitted.
Okay.
The other 99% got it from a mosquito bite via travel.
And these are all South states?
No,
Southern
we
states?
have several in New York and New Jersey, and several in Florida.
Is there any was there any pregnancy in the New York, New Jersey area too?
Yes.
Well, yes, there was
There
recently.
was recently. And these are all the travels.
In New Jersey,
they
correct.
traveled
And New
outside
York
of the,
City, actually.
outside of
Correct.
the, in New York City
We
too?
have
Yes.
one mom with microcephaly baby and one in New York and one in New Jersey.
Is there any abortion that related with Zika virus, or they have chance of aborting earlier?
So there is a possibility that a miscarriage could happen if the infection happened early enough in the pregnancy. But again, we don't 100% know.
Thank you, Dr. Kojaoghlanian.
My
Thank you,
pleasure.
Dr. Merjanian.
Thank you for having us.
Giving us up-to-date Zika information. Now it's time for this week's article. It is about alcohol consumption and risk of skin cancer. Basal cell carcinoma of the skin is the most prevalent cancer in the United States. It has been estimated that more than 2.5 million basal cell carcinoma are diagnosed each year. Solar ultraviolet radiation is the major environmental risk factor. Alcohol and smoking are major lifestyle risk factors for basal cell carcinoma. Alcohol consumption is a well-known risk factor for many cancers, including larynx, esophagus, pancreas, breast, and prostate cancers. Acetaldehyde is a major metabolite of alcohol and is known to have direct carcinogenic effect by causing oxidative stress and damage on DNA and our genes. Recently, researchers from Brown University investigated whether alcohol consumption is associated with risk of basal cell carcinoma of the skin. Prospective analysis was done on more than 160,000 women and 40,000 men between 1986 and 2011. Conclusion of this study was that alcohol consumption was associated with increased risk of basal cell carcinoma of the skin in both women and men, independent of sun exposure. What kind of alcoholic beverages were more damaging? Well, white wine and all hard liquors increase the risk of skin cancer. 1 drink a day was enough to increase the risk. Beer had no negative effect. Protect your skin using sunscreen every day and don't drink alcoholic beverages at the beach. Good health is precious and priceless. Keep informed. For up-to-date information, visit AAHPO's website, aahpo.org. I'm Dr. Orhan Karatoprak. Until next program, so long.